The community is continuing to see the impacts from this particular case. The closing of the Rand family practice in Reno is, of course, adding to the shortage of primary care physicians right here in Reno. Erin Breen joins us live in the newsroom with more on that part of the story.
Well, Kristen, we've been at the bottom of the list for doctors per capita here in Northern Nevada for 2 decades now. And the latest report, which was actually put out by UNR School of Medicine just today, puts our ratio for primary care physicians per capita right there at 50th in the nation. But they say we're working on fixing that. It takes a good month or two to get in as a new patient to most primary care physicians in Reno these days. And now hundreds of patients who, until recently, had a doctor have been added to those lists.
You try finding a physician in Reno, it's pretty hard right now. So it's going to be kind of challenging for those people, and we want to have compassion toward those people because to no fault of their own, their physician isn't able to see them anymore.
But this area is experiencing the perfect storm for such a shortage right now.
It's very difficult, and it's probably going to get worse because we believe that the principal drivers of that demand for physicians, whether it's a primary care doc or a specialist, is population growth, population aging, and an improving economy, and we're seeing all three in Northern Nevada.
Packham says that a lot of those patients were clearly there for the right reasons.
There are always legitimate examples or cases of individuals needing those prescription drugs, but overprescribing is, again, a nationwide problem.
But he adds that it's the big picture that counts.
It's going to hurt us, but my view is that, if the allegations are true, it's a net detriment to the public's health. And anytime you have a practitioner like that doing what he or she is doing.
And he says while we're still at the bottom of the list, we are taking the right steps to change that by recruiting doctors.
We're also doing phenomenal work in terms of increasing the number of advanced nurse practitioners and PAs who also provide primary care, typically in a office-based or clinic setting. So we're addressing that primary care demand and existing shortages in a variety of ways.
Now, Packham also says that the state of Nevada is also expanding both undergraduate and graduate medical education here to try and help add to the medical workforce. Covering the story, Erin Breen, Channel 2 News.